As a psychiatrist, I'm an advocate for women's mental health because women tend to suffer from a depression a lot more than men do. I often ask employers, depression is my business, but how much has yours suffered from it? What I've done is I've combined my two passions. I compete in pageants, I'm a physician, I'm a pageant doc. Yes, I was a contributor to the book called A Healthier You, where also Dr. Deepak Chopra and Billy Blanks were featured. I felt psychiatry, of all the medical disciplines we have out there, it seemed to tap into my creativity. One statistic is that there's a $193 billion loss to the economy coming directly from mental health disorders. As a dancer and as a performer, I actually didn't find anything wrong with the talent that they performed. This was a world competition. I know about how much training they had to put in, weeks and weeks of hard work and coordination, and the performance was just beautiful. So from my eyes, I didn't see anything wrong with the talent that they displayed. We have to understand Heidi is young and her job requires her to be a certain way. And what happens is sometimes people start thinking that this is what they have to do. They have to go through the plastic surgery. They have to look a certain way. When I first looked at the video, I actually laughed because it did remind me of the girl chipmunks that danced to Single Ladies in that movie, Alvin and the Chipmunks. If you think about it, the chipmunks are like little girls, and so they might have even gotten that idea from there. Movement is a part of dance. And these girls may be too young to understand exactly why they're moving a certain way. To them, it's just another step. She was fine even before all the plastic surgery, but I think with the societal pressure and maybe whatever else is going on in her life or in her family or interpersonally, we don't know. I really do think that pageants should be considered a sport if they aren't already, because everything that you do to prepare for a sport, we do in pageantry. We prepare, we train, we actually do a lot of hard work. It's discipline, it's determination, it's a competition, we're being judged, so it's no different from any other sport that we play. The difficult part of a psychiatric patient, first of all, is getting the history, because that's what we base most of our diagnosis and the clinical symptoms and trying to figure out what is the best treatment for the patient. So that's why it helps to sort of be a little creative on how to get that information out. Employers need to understand that it's great to train your employees on how to be better employees and get them to go to seminars and, you know, improve their productivity, but they don't understand that depression itself can affect their productivity. And we need to start implementing mental wellness programs into the workplace. You have to think about the message that media is sending out, whether it's in TV, magazines, or films. Everybody wants the perfect image, the perfect body, the perfect face. So what people tend to do is try to look like that. That's the ideal or the perfection. Nobody's ever going to come out and say they're depressed. They'll hide it with somatic complaints. They'll say, I'm not feeling well because my back hurts, or they'll call in sick because their stomach's not doing it. They're never going to give you an excuse that they're depressed. Some of the symptoms you want to look for depression: if somebody's not eating well, not sleeping well, they don't feel like doing their day-to-day activities, they're not going to work, they're isolating themselves, they're even talking about suicide. Well, given that 2% of all cosmetic surgeries are patients diagnosed with body dysmorphic disorder, it is probably a good idea for surgeons, doctors, and especially dermatologists to really screen these people for this type of a mental disorder, because it could be just that they're actually making it worse for them, because when these patients do come in and get one surgery, chances are they're going to get multiple surgeries. So if there's a pattern going on, then doctors really need to be aware of it, because they're just sort of feeding into the illness. It's important to look beautiful, look good so you feel good, but then you also have to think about doing good. Depression is the leading cause of disability worldwide. So it's not only a problem in the US, but it is a problem everywhere. It's a global issue. I really want to teach people how to win in life, how to win from within, and not just, you know, when it comes to competitions, but winning for yourself, how to make yourself the best you can be.